Someone who's exercising regularly is 20 to 30% less prone to cancer, and he's less prone to diabetic by 20%. Also, he's less prone to other issues like thyroid, gastric issues, all those things. We are not only discussing about physicality here, also it has shown that people who exercise regularly, their mental state is much better and their psychological well-being is also much better, and they get 30 to 40% discounts from any mental related illnesses like
if you are not stressing your body.
right.
As you're aging, your body starts to think, okay, you've kind of reached the point where I don't need to do much now to look at healing or growing.
A lot of research has shown is that if that is the circumference of your arm, people who exercise, they have more muscle mass in that particular area. People who don't do exercises, obviously it is replaced by fat.
That's very interesting.
Yeah, so the fat is more heavier,
Absolutely.
and that can
Now that this fat instead of muscle is going to affect so many other things, right? Even your metabolic health, because we know that fat is inflammatory in nature. And then now you're going to have insulin resistance, and then you're going to become pre-diabetic or diabetic. So this is a cascading sort of an effect.
see how the dots are connected.
Absolutely. Absolutely. Hi everyone, welcome back to the Biohackers Club. Today we are in conversation with Dr. Manoj, who is a senior physical therapist with a specialization in physical therapy and sports rehabilitation. In this conversation, we explore and understand why movement is medicine. We also understand why the quality of movement matters more than the quantity of movement. So without further ado, let's get started. Hi, Dr. Manoj.
Hi,
Welcome to the Biohackers Club.
thank you.
Thank you so much for doing this. Honestly, I'm very excited about today's conversations for two reasons. One, I know you're a powerhouse of information and experience when it comes to movement. And second, because, movement is just so important.
Yeah.
Personally, I think it's the foundation of health. And as a biohacker, I look at function or look at movement as medicine.
Yeah.
But I realize that often people approach movement more from the lens of just burning calories.
Right.
So I think let's start there.
Uh-huh.
Would be great to understand, how do you look at movement? How do you define it? What kind of importance do you give it when it comes to the overall health?
Right, sure. First of all, I'm happy we're discussing about movement as medicine, which is a non-pharmacological discussion, right?
True.
So, yes, definitely movement is medicine. This has been, this term has been phrased, I think it's ancient.
Right.
Apart from the diet, they thought that movement would be very important in anyone's well-being. That's what this terminology was initially, I think, coined as exercise as medicine.
Right. Right.
Right. So, exercise is something which is done in excess, working towards particular goal. That was termed as medicine because if you see the statistics, 68% of deaths are because of non-communicable diseases.
True.
Right.
True.
So there's a lot of morbidity and mortality which is happening because of non-communicable diseases.
Right.
So a lot of researchers have found that exercises along with diet plays a major role not only in preventing these problems but also managing these conditions. If someone has diabetic and he's regular with his exercises, this helps in taking care of his disease process.
Right.
And people who exercise, they get a lot of discounts. For example, someone who's exercising regularly is 20 to 30% less prone to cancer, for example. And he's less prone to diabetic by 20%. Also, he's less prone to other issues like thyroid, gastric issues, all those things.
Right.
We are not only discussing about physicality here, also it has shown that people who exercise regularly, their mental state is much better,
Absolutely.
and their psychological well-being is also much better,
Absolutely.
and they get 30 to 40% discounts from any mental related illnesses like dementia, all those things. So there's a lot of discounts for people who do exercises. That's why exercises is termed as medicine. But later, I think in the industrial revolution, when around 2000s, when people start sitting in front of the desktops, yeah, they spent at least 8 to 10 hours sitting in front of the desktop, and this terminology was not working anymore, even though various campaigns were made as exercise medicine. Then they felt that sitting was a new smoking after the invention of desktops. So they said now they need to move enough so that also would play an important role in prevention of any problem. That's why I feel that even though this is interchangeable, so exercise as medicine was slowly changed to movement as medicine, and the necessity for moving enough throughout the day was emphasized.
Got it.
Yeah, yeah,
Got it.
yeah.
No, this is fantastic. I think love the way you spoke about discounts. You know, when people who work regularly, work out regularly, get discounts.
They get a lot of discounts.
Yeah, and I love that, right? Because you shared the statistics really well, and I think it just kind of highlights how important it is to just move, if not exercise.
Yeah.
And thank you for sharing that timeline. That was very interesting. I didn't realize how because of sitting becoming such a big part of our lives, we moved from exercise becoming something that you're focusing on as medicine to just saying, hey, listen, we need to move.
Yes.
So we're not moving enough.
Right.
And you're right. I mean, we say this often that sitting is a new smoking without realizing what that actually means. So, just kind of as an extension to this, when we first met and during our sessions, there was something that you said that really stuck with me.
Right.
And you just said this again, that it's not just about moving, but it's the quality of movement that matters. If you could shed some light to this, Doctor, I think that will be super helpful for the listeners.
Sure, definitely. Right. Any aspect would have both quantitative and qualitative parameters in them.
Right.
So movement, definitely, it is important that you move throughout the day, and that's when I think minimum 10K steps moving
Right.
was also part of this campaign. That they said that this amount of movement is necessary for you to burn certain calories and make sure that
You're getting enough.
yes, you get enough movement and burning the calories. But as far as movement quality is concerned, there's a saying that first start moving well, then start moving more. If I give an analogy of, for example, if there's a vehicle which is wheels
Right.
misaligned, the more it is loaded, the more it's going to run. It's going to cause wear and tear of structures in it.
Right. Right.
For example, someone who has got little valgus, valgus in the knee, it's called functional valgus. What do you mean by that? Suppose in the knee, while landing, if it lands in certain angle, so the weight distribution is very uneven,
Right.
right? And this causes lot of wear and tear of structures. And your energy levels is not utilized to do the activity which you would want to do while it's handling, while the energy levels is handling the imbalance, or the muscles
Very interesting.
are utilized to use the imbalances. That's why without a qualitative movement, your effort is not going to be 100% towards what you'd want to do.
Right. Because it's actually balancing the imbalances, right?
Yes, and this was initially seen in athletes and measured in athletes. They did something called functional screening.
Got it.
So basically, how you move here is the way you're going to move in the arena, in the sports arena, right? So they did something called functional movement screening.
Got it.
Like in any sports, there are certain basic things like ability to squat, ability to lunge, hinge, rotations, lunge, push, pull. This is all part of any sports.
Fair.
So they said that this is the 5, 6 important movements which we need to measure, and they took them to the clinic or the lab where they checked how the movements are, and they gave a qualitative assessment. They added quantity into the qualitative assessment, and they gave scoring to 0, 1, 2, 3, 4.
Got it.
Whether you're moving well, especially suppose you're squatting, is there any deviations out? And those deviations, where are they coming from? Are they coming from ankle, knee, hip, or the spine?
Right.
So this deviation will help us understand how the person is and understand where the weak link is in that person and help us get them better those weak links. As far as physio is concerned, as a physiotherapist, you manage injuries. That's one role.
Right.
But there are two important other roles also. One would be prevention of injuries.
Yeah.
That plays an important role.
Important. True.
Third is performance enhancement. Right. That is also an important area where a therapist plays an important role in that.
Right.
Now, what is that? Performance enhancement. If something is moving well, definitely the performance of the thing is going to be much better than a thing which is not moving well.
True.
That's why basic things are measured like hinge length, squat, pull, push, and see that whether the body is moving well, where are the deviation, what is the quality of the movement, what is the range of movement, how flexible is the movement. All these things are assessed, and that also becomes a starting point from which this athlete can be developed. Yeah, so that's how quality is measured.
Right.
And later, that was taken into consideration into normal individuals and
I was
people.
going to ask you that.
Yes, people who do regular workouts. Again, I'd also call them athletes because they spend 2 to 3 hours working out in the gym.
Fair.
It's like they're treating that body like an athletic body, which is good. So they also need this knowledge of not only the quantity. It's not about how much I lift.
Right.
How I lift also would be playing an important role in injury prevention and improving performance. That's the most important thing that they would want to look at. That I don't have injuries, but am I performing at my best? I meet people who started with doing a 80 kilo, for example, deadlift.
Right.
Now they started lifting 80 kilo before 5 years. If you ask them, they're doing 70 kilo now, and they're finding lifting 70 kilo would be difficult now. Why? Because of the movement quality, the performance has gone declined over a period of time.
Right.
Yes. So it's not always injuries. Someone also need to look at how is my performance over a period of time. If someone has hit the roof and he's not able to move from that bar, I think even without injuries, he need to look at his movement assessment or the quality of movement. Yeah.
This is very interesting, and talking from my personal experience, when I came to you for my sessions, I had a very similar experience because I had been working out for a long time, and then you maybe do a couple of things and recognize those imbalances. Doctor, I left strength training for a couple of weeks, and I realized just getting those things right. You taught me some basic movements. Was making me feel a lot more sore than lifting on the weights I was lifting. And love what you said in the beginning. I think we look at it in the opposite angle. You said move right before moving more.
Yes.
So improve the quality of movement before the quantity.
Yes.
We always look at it in the opposite angle. I think when we give each other advice or even from a functional angle, when we look at it, we say, start moving.
You're right.
We'll improve later, you'll get better later, but just start doing it.
Right.
I think this is a very, very new but important lens to look at movement from, that drawing from the analogy that you gave, that if the tires are misaligned, you're not going to just tell the driver, hey, listen, keep driving,
Right.
then it will become better.
Right.
So that's a great analogy. And I think the other thing which was very interesting for me is the example that you gave, that if there is a small imbalance, like say even in the knee, the example, that you shared, the muscles are actually not being worked in the way you want them to work because they're focusing on balancing the imbalances.
That's right.
And which means obviously there's going to be more injury. And obviously performance is going to be compromised. So this is fantastic. I think I've got my big takeaway from this conversation, that
Right.
quality before, quality before quantity
Yeah.
is important.
Yes.
Now, as an extension of this, because you're talking about quality of movement, two things, flexibility and mobility. Typically, one, people take it for granted.
Right.
Second, they also look at flexibility and mobility as the same thing.
Right.
How do you look at these two?
Right. So, if I can add to the last point, yes, you need to start moving before you assess the quality of movement.
Fair.
Yes, because
Fair.
you need a lot of motivation to move. So once you're moving, I think movement assessment will work like a baseline from which where we can start your journey.
Right.
Like in a movement assessment, you're going to know about your weaknesses, your strengths. How we call it as your strength deficits, your mobility deficits, your flexibility deficit. And once the baseline is seen, you want to do a movement assessment after 6 months and see where your progress from
How?
which level to the other level. Now, for you to move better, definitely you need mobility, strength, and control. So, if we measure a movement and we find certain deficits, again we put them into mobility deficits,
Got it.
strength deficits, and control deficits. And these are the problems which we are going to work on.
Right.
Right. So, for you to move well, first of all, you need mobility. For example, if you would want to squat down and go full, give me a full squat, you need mobility of ankle joints, good mobility in the knee,
Right.
and good mobility in the pelvis, which is hip also. So all these joints would contribute together to get that movement quality in terms of mobility.
Got it.
Now the muscles around the ankle, knee, and the hip, they provide control to this movement, and all the control comes from the mobility. So from the strength of the muscles.
Right.
So a mobility is your ability to do a particular movement into a particular range. Or even if I'm able to get up from the floor and go to a place, that's the mobility of you. You're able to sit on the floor is mobility.
Right. Right.
So mobility speaks more about joints. Even though this mobility, flexibility is used interchangeably, but mobility speaks about joints more, your ability to reach that range
Got it.
in terms of joint. A flexibility is more of a muscle component. Where is this muscle flexible for you to do this activity?
Got it.
So that's the difference. Sometimes it's interchangeably used, but it's a different this set.
Setup.
Which says that one is from the joint, one is from the muscles, and once you have them both, that they both will help you to gain a good movement quality. Along when you have both, you need good movement muscle control also.
Right.
That's why movement assessment assesses more quality of how you move, and why it also keeps a check on the quantity of joints, how much they are moving in terms of range of motion, and the flexibility of muscles.
Got it.
Yeah.
Got it. So if I was to kind of break this down and let's take squats as an example. So we're essentially saying that mobility is the range of that squat motion. So let's say if you're able to go all the way down and come up,
Right.
that means there is mobility in the joints that you spoke about.
Right.
But the control of that movement, being able to do the movement in a controlled manner, will then bring in the strength of the muscle into play.
Right. Strength along with nerves also. That is, we call it as neuromuscular control.
Right, right.
When you exercise, you strengthen the muscles, but you also bring in more neural networks, which helps you to move in a particular way. So, neuromuscular control is a very important part of quality of movement. So, how controlled is a joint moving?
Got it.
Yes.
And that's a great point you touched upon because going back to something you said earlier that, working out or moving
Yeah.
is not just about physical health.
Right.
And this particular point that you touched upon, I think also signifies how it's important for brain health.
Right.
It's all interconnected. I mean, the body is a whole unit.
Definitely.
So, super. Now, if somebody wants to assess their quality of movement,
Yes.
is there something they can do and how can they go about it?
Right. Typically, a movement quality is assessed by an expert.
Right.
He needs to do a series of tests, again, which involves a squat test, a lunge, a hinge test, where it's ability to bend and touch.
Right.
And you'll see when someone is bending and touching, there'll be a lot of deviations towards reaching the toes. For example, if someone is squatting, you'll see that their feet goes in,
Right.
or someone needs to keep the toes out when they're going to squat. That's called compensations. So the brain is the king and it appreciates that my task should be done. For example, it says squat. How you squat is not just progression.
Right.
So that's why you do something called you trick your body and make sure that you compensate for those movements and you do that movement. When you use a term called compensations, then you know that your quality is lost,
Right.
and definitely you're making more effort, and you're putting a lot of stress on the joints to bring in particular movement. In studies, especially in athletes, people who have less knee control, or if they have valgus control, loss of valgus control in the knee, they tend to have more meniscal injuries and ACL injuries. So see how the movement quality is connected to this one also.
Right.
So assessing a movement quality helps you to understand that will you get injured, and that's why you take necessary action so that you prevent them from having injury. Yeah.
Got it.
So, like I said, squat is one form of assessment, hinge is one form of assessment, and push and pull. So, how is it decided is that most of the movements which you do in any sport involves basically all these things.
Fair.
Where you'll be squatting in some of the movement, you'll be pushing, you'll be pulling. For example, if there's a boxer, you'll be giving a push there. So you need to assess the movement quality, how strong is the muscles, and he does that. When a footballer is trying to kick a ball, he is standing on one leg and he's taking the one other leg. So what is the control of this knee, which will also help you to understand the quality, the other rest of the mechanics. And also simply for recreational runners, when they run, when they land on one feet and they keep
Right.
yes, it's floating phase and a landing phase. In the landing phase, some of them talk about pronation of feet, right? They talk about valgus in the knee. They talk about pelvic drops. So these are all parameters which we see, and that is when you do the basic movements, you know that these parameters are weak, and we check their strength and mobility. We understand the thing as a whole, and then we start working on them. So basically, yes, all those things. Basically, it's the basic movement patterns which we do in day-to-day activities. Nowadays we don't squat anymore.
Yeah, which is sad, right? Because I was going to say this should be part of our day-to-day lives.
Yes, earlier it was.
Right.
Yeah, but now since it is so much mechanized that we don't squat. But again, your exercise should include all this basic movements training. Once you train in them, I think your overall quality of your workouts is going to improve, and the chance of you getting injured is also going to be very less.
Absolutely.
And your efforts is going to be completely shown in you rather than wasting in any other tricky movements. And someone is having a bad movement quality, and when they do heavy weights, they get very strong in that very bad postures. To even bring them back to a normal posture is a big task. I call it as running fast in the wrong direction. So the more they load, they're running fast in the wrong direction. So even to bring them back, it's a task because you trained yourself in the wrong position.
Right.
So it is strongly recommended that people who do weight training, or people who are starting to do weight training, or people who are already doing weight training, now it's time that they focus on movement quality, get themselves assessed of how I am moving, and see whether there is any connection between my injury and this movement which I am having, or my performance and the way I move. I think it's high time that our population starts doing
Right.
and think about the quality of movement.
I agree.
Yeah.
I agree. Before kind of diving into a couple of things, just to understand this better, you spoke about valgus knee.
Yeah.
For my understanding, it is essentially, in simple terms, just kind of the misalignment of how the knee moves. Is that a correct understanding?
We're talking about valgus knee. Uh, a valgus is a condition where the angle in the knee increases, but we are talking about functional valgus. That means if you look at the knee, it's straight.
Right.
But when you start loading the knee goes in like that. So that's this is the inside of the knee, this is the outside of the knee. So when you're landing your feet, the knee is going a little bit like that, causing a valgus stress here, or a stress kind of a knock knee kind of an angle, right? So we do something called as a step test, step down test, where you're standing on a small platform and you're trying to step down and see how the knee is behaving, whether it is staying straight or is it going out
Yes.
or it is going in.
Got it.
And what is the balance while doing that task? Are you compensating it anywhere? So some people lift their heels up to reach for the toes. That means they have a stiff ankle. Some people rotate too much. That means they have a weak hip.
Got it.
Right. So a valgus is a valgus, functional valgus is where normally when you look at it, the knee is straight, but when you make them do some activities, the knee sulks in, going inside, which causes a lot of pressure on the inside and both outside of the knee, which can lead to certain knee issues if you're participating in sports.
Understood.
Yeah.
And when we're sort of continuously moving, or let's say weight training as an example, if you're continuously weight training, like you said, the brain needs to get the job done. So it just makes those compensations. Yeah. Now we're training with those compensations, so those compensation becomes our sort of trained methodology.
Right.
Now, if we continue to do that, that is where the wear and tear and the injury proneness actually comes into play, and it's not the movement in itself. So people start fearing the movement. I hear things like, if you work out too much, you'll end up, ruining your knees. If you work out too much, it's actually those imbalances that we are working with without correcting for the quality of movement that leading to the injuries.
Yeah.
Right.
Definitely. Like you said, most of us start working out when you're in our 40s actually.
Right.
So apart from other reasons like our innate weaknesses, one of the important thing why people get injured is because of training error.
Right.
They start doing training too much. Body it has a capacity to accommodate to any amount of stress if given over a period of time.
Fair.
That's most important.
Right.
Body is just a byproduct of what stress is given or not given. But the rate of stress plays an important role here. That's one of the biggest mistake we do, that we go into the gym and start training as fast as possible,
Right.
and which our body is really not used to. But it has the capacity to take any kind of loads. You see athletes lifting 300, 400, 500 kilos because they have done it over a period of time,
We're built up.
over a period of time. So training error seems to be playing a major role, close to 60 to 80% for reason for injuries.
That's a huge.
Yes, everyone should know that training, heavy training, or very irregular method of training is one major reason for injury. Yeah, people also who have this qualitative issues also can get injuries, because you can see in a valgus stress in the knee, we have a medial side and a lateral side.
Right.
There are cartilages in between them. So, suppose if I increase my weight by 1 kilo, there's about 7 to 10% of stress increasing in the knee because of a small surface area.
Right.
Imagine that my medial knee load is off by 10% and my lateral knee is taking more by 10%. Obviously, the wear and tear will be happening more in the lateral aspect. And this is what either leads to injuries over a period of time, or leads to compensations and not improving the performance over a period of time. They feel that they hit the roof and they're not able to progress anymore.
Right.
Yeah.
Right, absolutely.
Yeah.
And, when he spoke about overtraining and how a lot of people who begin in their 40s, how they approach training, I want to come back to that. But before that, going back to the previous point, where we were talking about assessing and quality of movement, would it be fair to kind of, for a lack for better way of doing it, break people into two buckets and say one bucket where people are just starting to move?
Right.
Or actually not moving at all.
Right.
Because honestly, you spoke about squats and you spoke about push and pull.
Right.
Simple movements, which, like you've rightly said, is a part of every sport.
Right.
But it's also part of everyday life.
Right.
You just say, don't do it, we should be doing it. And I think it kind of builds the foundation of how mobile or, healthy they're going to be as we age.
Yeah.
I today see doctor people or children in the teenage years, 13, 14, who are not able to squat.
Right.
And for me, it's a scary, even though, not to say I'm too old, but I come from a generation where we did squat and go.
Definitely.
And then of course I worked out, but looking at kids who were playing sports to some extent, but I thought squat is like a basic movement.
Right.
So coming back to these two buckets, would it be fair to say people who, one, are not either doing these basic movements or not able to do these basic movements irrespective of age?
Right.
Would it be fair for them to first start to accomplish these movements? Just get the squats, like just try and do squats every day.
Right.
Forget about the weights.
Right.
Try and do basic push and pull movements, maybe lunges. I don't know, these sort of various movements that they can begin with.
Sure.
So, one, that's the question I want to ask you. If somebody starting out, irrespective of age, what are those basic fundamental movements you'd say they should begin with? And the second bucket is people who have been working out. People who've been weight training or maybe playing some sort of sports already. I think for them, like you rightly said, if it's about time we start looking at quality of movement, right, that some amount of movement has happened for a given period of time.
Right.
Now analyzing the quality of movement to be able to fix those imbalances, even if you're not athletes,
Right.
I love that you said people who work out every day. I like to think of myself as a functional athlete of sorts because, you're training your body.
Yeah.
But you're right. Because they've been doing it for so long, invariably they might gain balances, which we do not be able to see. So, two buckets again. The first, we just get the basics started.
Right.
What should they do?
Yeah.
Fundamental movement. Second, I think we've established that, hey, listen, go see an expert and get your quality of movement analyzed. So, at least you know what you need to correct.
Right. Yes. So let me tell you a few tips in terms of one of the questions sounded like should they learn ABC before learning grammar? So right. So yeah. Again, quality is decided by certain components. Like I said earlier, mobility,
Right.
flexibility, and control of the movement. All these three decides the quality of the movement. All right. So people who are starting certain things, instead of focusing on quality directly, what are the things they should focus on? That quality will automatically will be part of their workout.
Right.
So number one, they need to focus on basic mobility training. So even before starting strengthening program, which you are so much excited to start it is, I think the prelude like ABC before going to grammar would be do a good mobility programs. Get all your joints mobile by doing basic mobility exercises. Even if you just Google it for basic mobility exercises, you'll get them.
Right.
Number one. Number two, again, flexibility training. Make sure that you're able to bend and reach for your toes or see where is your basic level of flexibility.
Okay.
And start doing basic flexibility training like leg raises, stretches, shoulder stretches, all those things. Again, that should be part of basic. This is not only for people who are gym goer, this is for everyone who's involved in any exercise. I'll include sports also into exercises. For example, I want to play tennis. And before that, make sure that you do that mobility exercises, make sure you do flexibility exercises, and you need to train control. How do you get control? Take smaller weights and repeat them very number of times instead of loading high.
Right.
The moment you start loading high, you'll start compensations because you're not able to do that particular thing. You have mobility, you have flexibility, but you don't have strength now. That is also a way you can compensate. So start with lesser weights and slowly progress to the next level.
Got it.
Yeah, these are three very simple things.
Absolutely.
Last but not the least, again, that's why there are a lot of mirrors in the gym. Just look at your movements, see how you're moving. Be a little more aware of your movements rather than just coming into the time and just pushing yourself. Yeah. Just be aware of your movements, look at your movement and see whether you're using right muscles. Also, suppose someone is working on their glutes. If they don't feel any burn in the glutes, obviously they're doing something wrong.
Right.
So isolate that movement and see whether that particular, it's more about awareness of how you're moving.
Like the mind-body connection. And at least we very often forget that that's the fundamental thing that we need.
That's right.
You're just living for the heck of moving.
Yes. So these are the
Right.
basic three tips. Work on mobility, work on flexibility. Definitely make sure that you progress slowly. Mostly your movement quality is going to be very decent if you do the basics, right?
Right.
Now, people who are already training, who are already pushing, who are already running in the wrong direction if they're not aligned well. So, before they suffer any injuries, I think meeting a professional, because you are an athlete now.
Right.
You're spending your 1.5 hour in the gym lifting heavy weights. So, when just the process is one of the training processes like athlete, you just need to deal everything like an athlete.
Right.
So you just need to assess your movement quality, and I think for that you need to meet an expert.
Right.
I strongly recommend that you just need to find out who is the expert close to you who does a movement assessment, and it's getting an assessment that would be of high recommendations. Yeah.
No, but I absolutely second that because before I came to you for my session, therein I was one of those gym goers who are very proud and get like thinking, hey, I can lift this much, I can do this.
Yeah.
And then it is very humbling to recognize that having done something for so many years, you don't realize that there are imbalances.
Right.
And you need an expert eye to figure it out. The example that you gave is if somebody's possibly, misaligned while squatting, it's not very easy for us to see it when we're seeing ourselves in the mirror. The foundational elements maybe we can see, but those smaller nuances you need an expert eye. So I absolutely second if you're working out consistently, go seeing an expert to understand the quality of movement. Doctor, coming back to the second plate, you spoke about people who hit the gym or start working out when they enter their 40s. Now, again, a big advocate for strength training.
Right.
I do, I've changed my routine quite a bit after our session. That added mobility and flexibility work in my weekly routine, but yes, so, and it's helped a lot. Like I said, even in the performance overall.
Yeah.
So, having said that, I do believe that consistent strength training has played a big role in keeping me healthy as I creep towards 40. And I recognize, you also said this earlier, it's not just physical health, right? It's everything from metabolic health to cardiovascular health to brain health.
Yes.
Now, we advocate for movement quite a bit.
Right.
And I do recognize that people specifically, after 40s, yes, maybe even mid 40s,
Right.
who have never done it before,
Yeah.
approach it in two different directions. Either they go all out, let's just kind of, because there is a certain fun element to starting something.
Right. Right.
And then there is the other bunch of people, specifically I see this with women, who really shy away from strength training because it can be a little bit intimidating. They've never done it before. And then there are a lot of these socio-cultural, sort of misinformation around strength training for women. So for both of these,
Yes.
what is the advice you'd give them getting in?
Right. Okay. Means with time, with age, definitely you're losing your strength.
Right.
You're losing your mobility, and definitely the quality of bone goes down with age because of there's a lot of hormonal changes. One way to keep yourself mobile, fit, is by definitely activating these stressors. That activation will happen only with the amount of load you put onto the body.
Right.
That means you need to be doing some amount of weight training or some amount of stress training for a good physiological changes to happen in the body, right? For example, growth hormone.
Right.
So if you're not active enough, the brain starts thinking that, okay, in life, I think she's coming to that.
This is.
Yeah. Like she's in 60s. Body's mind starts thinking like that. So there is no necessity for me to produce enough growth hormone.
Right.
A good growth hormone, which definitely takes care of bone health, your muscular health, and health of lot of other areas. Even normal repair happens with a good level of hormones.
Absolutely.
So the stressor is in the form of weight. So definitely weight training has its own advantage. Because when you work out, there is something called micro trauma which is happening. That micro trauma leads to various other reactions which will help your body to improve the capacity of healing. It reduces the inflammation in the body. So this stress would be very important. It can be done in any form, but weight training would be a simple form to get that done. To start with, where you're trying to increase the capacity of the body. the capacity of the body should be built over a period of time.
Absolutely.
Over a period of time, you're losing your capacity. For example, at 20, my body's capacity was 80%. We don't utilize 80% all the time. So we are designed, we have about 600 odd muscles, 300 odd joints in the body. This is all we are designed in such a way that we are supposed to move, we are supposed to be loaded actually. So, which we don't do because it's highly mechanized.
Right.
So, a strong recommendation of loading the joints is a must for anyone to maintain their musculoskeletal health, for anyone to suffer less from their aches and pains. Even the joints, they get stronger. There's a cartilage lining in the joint. People who work out regularly, the cartilage thickens and definitely their wear and tear goes down unless until they are doing too much. Otherwise, every part of the body responds well to exercises. And when someone is exercising, their ATP levels go up, their energy levels go up.
Right.
So people who feel dead at the end of the day, I think it's highly recommended that they start doing some weight training because your energy capacity storage increases, and it is highly recommended to prevent you from a lot of problems which happens with age. Just with age,
Right.
certain problems happens, and weight training is one of the good solution. Yeah.
Right.
Yeah.
Yeah, I think just, like you said, to prevent just the basic stuff that happens as we age, we go back to where we started, movement as medicine. So we got to move to good end those. Also love how you said that, you put this in perspective that if you are not stressing your body,
Right.
as you're aging, your body starts to think, okay, you've kind of reached the point where I don't need to do much now to look at healing or growing. There's a famous quote that I usually like quoting, which says that aging is a aggressive pursuit of comfort.
Yep.
Because there is constantly wanting to do some comfort to go. These stressors are important.
Yes.
So, Doctor, coming back to, you really spoke about strength training,
Yes.
right? But coming to age-related muscle loss,
Right.
or sarcopenia. Now, I do believe this, and I've recognized that a lot of researchers have now started to draw a direct causation
Yeah.
between age-related decline in movement
Right.
with this loss of muscle,
Yes.
rather than losing muscle just because of aging.
Yes. Right.
So, in your experience, is that true?
Yeah, very much. See, the stressors are very important. Someone who's leading a very inactive lifestyle, obviously, again, people think that there should be a circumference loss of the area. Typically what we see is, and a lot of researchers has shown is that if that is the circumference of your arm, people who exercise, they have more muscle mass in that particular area. People who don't do exercises, obviously, it is replaced by fat.
That's very interesting.
Yeah, so the fat is more heavier,
Absolutely.
and that can load the joints more than normal.
Right.
So now here's a situation where you've gone weak, but your weight has gone up because you have to handle more weight because of the increased fat mass of the body. Now this imbalance puts a lot of load on the joints, and it slowly degenerates the joint. The wear and tear happens faster. So some of the signs of degeneration is definitely you have pain. You need not wait for the pain. Pain comes little later, but the joints are becoming less mobile. That's an adaptation. And the capsule around the ligaments around they're getting stiffer. They're not flexible anymore. So all this changes which is happening slowly is degenerating you faster and leading to arthritis or
Right.
your ability to move well. So the moment, the more you keep yourself fit, the better is your movement quality.
Absolutely.
82-year-old approached us that he would want to play golf actually, right? He was playing. Now, slowly over a period of last 6 months, he was not able to play. He doesn't have any pain, but he's just playing golf and doesn't do enough exercises.
Right.
So even though he's keeping himself active,
Right.
but he's not stressing the body enough, so the body's capacity is declining. Now we worked on strength training for a period of time. We worked on other areas like mobility, muscle control, flexibility, and balance. After a period of 3 to 4 months, he was playing golf again.
That's super.
And he's happy to play golf twice in a week. And now he has understood that some amount of resistance training, even though I'm active in my life, some amount of resistance training is very important to activate those stressors and keep myself active. Yeah. So it's important that steady setting plays a vital role in keeping you mobile till the end of your life.
Right. Now, that's a great story. And a wonderful example of how, approaching strength training or resistance training, even if you have like a social life which is keeping you active, is important. Ways. Just we seldom kind of, look at those separately. Now, we spoke about aches and pains in little bit. Usually when people are struggling with aches and pains and things like sciatica, etc., I hear that the first advice that they get is completely stop all movement. How do you approach patients that come to you with aches, pains, let's say sciatica, for example?
Sure. So any problem has phases into it.
Right.
First phase is called the inflammatory phase. That is a phase immediately after the injury or an insult. It could be anything, a sciatica or an arthritic pain, anything. In the inflammatory phase, it is very, very important that that particular part is rested. Because you don't want to trigger the inflammation.
Right.
Or the inflammatory cells are the one which causes more wear and tear, causes damage.
Absolutely.
So, depending on the acuteness of the problem, whether it is in inflammatory stage, so some amount of rest is needed.
Right.
Definitely, and rest would be the important first step. But this is not in everywhere. We are talking about when it comes to injuries. So we need to understand two kind of injuries. An injury which happened because of a sudden insult. Suppose you're running, you twisted your ankle and you broke the ligament. So now there is an inflammatory cascade which happens. So initially we do something called RICE protocol to reduce the inflammation.
Right.
Just for those 2-3 days, we don't recommend
Fair. You want that
any movement in that particular segment.
Right.
But we have treated a lot of people who just ankle was in cast or a brace after either fracture or an injury. But fifth day they were in the gym doing workout for all other areas.
Right.
Yeah.
Right.
To make people understand, I give a typical example. Suppose this is my consultation room. If some work is done in this room, I don't shut down the clinic.
Absolutely.
That'll be a big loss.
That's a great example. Absolutely.
So I tell them just close this room and continue your work. So just immobilize the affected area
Right.
and continue to move. That has shown that it helps you in healing faster. A second kind of injury is overuse injury. For example, you're doing some repetitive movement in a wrong way. For example, take a rope and keep rubbing it against a stone,
Right.
it will wear off. That's the second kind of injury. Typically, their rest would make it worse.
Ah.
If I could give you an example of someone having a tennis elbow which was happening because of repeated strain. And she met various doctors and therapists, but they had asked her to rest.
Right.
At the end of 6 months, she was in a worse state than earlier. When she worked out upstairs. I met her in the lift also last day. She was thanking me for making her start exercises. I said, you should start your gym. That's the first advice I gave her. And don't do this.
Ah.
She said, what? She didn't believe.
Right.
Till that everyone told me to stop. I said, see, you know what is your problem? One of the important problems is that you're not working out enough. You're mentally feeling so low,
Right.
which is also affecting your healing.
Absolutely.
So I completely gave her instructions on what to not do, but I gave her 100 things which can be done.
Right.
And I just met her once a week. Over a period of next 6 sessions, which is 6 weeks, she was very happy. A tennis elbow healed very well, which didn't heal for 6 months. So it's very, very important that we continue to move and understand what kind of injury it is.
Right.
If it is not a sudden onset injury, I strongly recommend that movement will help you to recover faster.
Right.
Yeah.
So these are great examples, and I think even the fracture or the ligament tear example that you gave is fantastic. Saying that you could just limit that portion, like you said. If your cabin has
Right.
going on, you're not going to shut the entire office.
Yes.
And yeah, I agree that just moving the rest of the body will actually help heal that particular the issue. Doctor, there's one more thing that you said, which was very interesting, that we were talking about age-related muscle loss, that it's not circumference.
Right.
Because your muscle could be kind of deteriorating, you're losing muscle,
Yep.
but this fat now that's coming there, so the circumference looks the same.
Similar.
It's just so interesting because typically in our heads we think that the person is becoming frailer when you're losing muscle.
yeah.
As drawing the parallel, you already said this, that now that this fat instead of muscle is going to affect so many other things, right? Even your metabolic health, because we know that fat is inflammatory in nature. And then now you're going to have insulin resistance, and then you're going to become pre-diabetic or diabetic. So this is a cascading sort of an effect.
Yes.
Got
You see how the dots are connected?
Absolutely. Absolutely. I think, I'm saying this again because we simply just go back to saying movement is in fact medicine, because it's not just about weight or the way we look. It's about health holistically. And this has been fantastic. I have to ask you one question, which is part of something I ask everyone, because at the Biohackers Club we work hard to optimize health span.
Right.
Honestly, everything we spoke about is optimizing health span.
Right.
But to kind of tie this together, if there is one fundamental takeaway that you would give to our listeners for optimizing or strengthening health span, or being able to live as healthily as possible for whatever the
Right.
amount of time they live for, what would that be?
Very good. Good. We are talking about health span here, which is leading a qualitative life.
Right.
And I strongly feel and believe that energy level of a person is an important deciding factor for his actions to be taken. Yeah.
True.
I'm energetic, and my decisions are so much linked to my energy levels.
True. Yeah.
So I feel as a biohacker, I strongly recommend that you need to improve your ATP levels in the body. That can happen through right nutrition and exercises. And I strongly recommend everyone to work out regularly, have the right diet, and again, cold baths. But again, everything to improve your energy levels. So once the energy levels are more, your decision making, your the way you work throughout the day, the quality of movements, I think that's just going to decide everything. So
True.
for me, it's the energy of the person which is more important.
That's superbly put, because yeah, absolutely correct. Right? If you don't have the energy to do something, we're not going to keep doing it.
Yeah.
And I hope you guys remember, we've spoken about ATP a couple of times. A simple analogy I give is the energy currency of your sense. So this is fantastic. Okay, this was very, very insightful. Thank you so much for taking the time to do this. I would love to do another session and do a deep dive into a couple of more areas.
Sure.
But thank you so much for making the time.
Yeah, thank you. You're welcome. And it was a pleasure to discuss these topics.
Thank you so much.